And one of the ways that I like using Dycem is in sideline lumbar traction. I use it to get a good grip on the patient's sacrum, and it provides no slipping and from a long sustained position. So that's one of my key ways I use Dycem in the clinic.
I have worked in a school-based setting for 30 years, and I don't think I could have done my job without Dycem. I use it in a school-based setting for feeding, positioning, and an educational setting for a wealth of activities.
And I use Dycem with my patients who have upper extremity amputations, and it helps them to grip their devices with one hand, and they are more functional throughout the day.
We do a lot of manual skills and manipulations using the Dycem to help with our manipulations.
I use Dycem all the time. In between wheelchair and cushions, or on the parallel bars, or during balance training to keep a foam from slipping on the floor. I love Dycem.
I use Dycem a lot. We use it to actually place our ergonometers, just like it's actually down here on the floor. Several types of that. A lot of my OTs use it to help prevent plates and bowls slide.
I'll use Dycem on a regular basis underneath my bottom on a rolling stool when I'm helping my patients walk. Love it.
Use Dycem on a daily basis to get our residents up, make sure they're not going to fall and their feet aren't going to slide out from under them, and we love the product. It's like gold in our facility.
I'm a big user of Dycem since 1969 when I first started practicing, and I always carry a roll of Dycem in my trunk so that anytime I have a use for it, I can run out and get it.
I've used Dycem before. I hurt my hand and couldn't even open a jar. That was fantastic. I was able to do, basic functions and things like that, so I highly recommend it.
And I use Dycem to help position kids in their seats, to help keep their toys or their activities at school on their desk and on their positioning equipment, and it works fabulous.
I use Dycem as a physical therapist when I work with patients with stroke, and I'm holding them and holding a ball, and I wrap the Dycem around the ball so that the ball doesn't escape while the patient's hand is on it.
I use Dycem on a grocery cart to help stabilize the hand so it doesn't slip off. I use Dycem. I have 2 hand pieces at home that I use to open jars with my splint. My husband borrows it too to use it, and my granddaughter uses a piece to help hold her cup on the table so she doesn't spill her drink.
I recommend Dycem products on a regular basis, particularly with my MS clients who have spasticity. It gives them a chance to put their feet down and I use it for under their feet, gives them a chance to get their feet down without slippage to go from sit to stand.
I live on a sailboat, and so I use Dycem because the sailboat rocks, and it really helps keep my life a little bit more stable, so I absolutely recommend it. It's great.
I love using Dycem because it is an all-in-one everyday use utility. I use it for treating patients to make sure they're sitting properly in the wheelchair, to make sure their legs and their feet are not slipping off the leg rest. I also use it for therapeutic exercise, make sure all equipment is in place. It's a great product and I highly recommend using it.